Hello, lovely. Lovely to see you again. How have you been keeping? That's good. I'm glad to hear that. So, I have your blood results here, okay, and it is indicating that you are going through menopause. All right. Yeah, we did expect that, didn't we? All right, so I'm going to ask you a few questions. But first of all, I would like to know if you've managed to have a look through the information I gave you. You did. Great. Okay. Do you have any questions about anything? Okay, that's fine. And any thoughts on starting the HRT? Okay, so you are thinking of it. Alright, so we could start you on a low dose. Did you manage to have a look at Google at all and search for natural remedies and things like that? Okay, I'll get my phone out for you in a moment and I will show you a few different things if that's alright. Okay. How have the symptoms been? Yeah. Okay, so what are the worst things that you're experiencing? Yeah. Yeah. Okay, so hot flushes, night sweats and nightmares. Okay, and how frequent are the nightmares? Okay, so that's quite a lot, isn't it? Okay. How's your mood been since I last saw you? Not too bad. Okay, that's good. Just keep an eye on that for me. Okay. If you can, maybe write a diary on your moods. Alright. Because sometimes we have to issue a low dose of antidepressants just to help move things along for you. Okay, so I'm going to monitor that for now. Alright. Yeah. Okay. That's good. Have you managed to feel your breasts at all and have a check around for any lumps or any abnormal things, any abnormal changes, etc.? Oh, brilliant. It's really good. I'm pleased about that. Make sure you do it once a month. Okay. No issues. Great. If you are concerned about anything, though, please don't hesitate and come to see me. All right. Right. So, I need you to continue to monitor your periods. All right, and just jot them down in a diary. Okay. But I would like to ask you, how is your sex life at the moment? Are you getting in the mood? Okay, that's very common. Yeah. Yeah, I can understand that totally. I feel like you can't put pressure on yourself. It needs to be more of a natural thing. But are you experiencing any pain during intercourse at all? Okay, that's good. What about any vaginal dryness? Okay, well, the HRT usually helps keep that at bay. All right, we can issue you some different kind of things to help lubricate, and there's lubes and things like that we can give you. But a lot of the time I find that the HRT helps a lot. Yeah, definitely. But again, I would keep an eye on that. Okay. So, are you experiencing any hair loss at all? Okay. Any skin issues? Okay. And what about any kind of pain anywhere or any abnormal things that you may have seen that you may want to mention? Okay, so that's good. You're not concerned about anything else. Brilliant, thank you. No concerns there. Great. I'm happy help you with that. Right, so let me get my phone. Okay, there is a lot of things on the market, creams, patches, things like that. Okay, and you'll find some are estrogen only, some are progesterone only, and some are combined. Okay, you will find a lot of conflicting information on the internet, and people that have their own views and opinions on certain things. Okay, a lot of people like to go down the natural route, which is where bioidentical HRT comes into it. Okay, so that is different to your traditional HRT that we give you. Okay, so basically the chemicals are identical to what our bodies produce naturally, okay, and they're from plant estrogens. The HRT that we give you is made from the urine of pregnant horses, and some are actually synthetic. Okay, yeah, so a lot of it is also down to thoughts and opinions on that. Okay, yeah, and it's trial and error. Some don't work for some and some work for others. Yeah, definitely. A lot of people do choose to go down that route. Like I say, there's a lot of good websites out there that sell different products. Yeah, I mean, there's some, for example, there's a cream and you can just say put a small bit on your arm and then you can change places and things like that. Yeah, definitely. So I'd give that a look and research into that. Okay. There's all sorts of different ones. So if you look here, this website there has all sorts of different products that you can actually purchase. Okay, and there it will tell you a little bit of information about all the natural products that they do and what's good and what's, you know, not good about it and things. So if I go on that one, there we go. Where are you? So these can actually be given through lozenges, capsules, tablets, dermal cream, vaginal creams, suppositories and pessaries. Okay, so there's a full variety. So, and they basically do exactly everything that a HRT would do. But some people say they're not very effective. So again, I would say it's trial and error. Okay, but definitely check some of these ones out that you can see here. Like that one with the creams there. Some are money back guarantee and different things like that. And I would definitely recommend some holistic treatments. Yeah, so reflexology would be good. Possibly some Reiki and yeah, things like that. Aromatherapy, but I would definitely go to somebody that blends the oils, okay, rather than pre-blended. Okay, and find a practitioner or something that will work with you on actually, you know, trying to help your health conditions. Yeah, a lot of them these days are just for relaxation, and they're not as highly qualified as certain practitioners out there, so make sure you do your research. Okay, you probably won't really find that in spas and things. Okay, yeah, but as I say, vitamins and minerals and obviously omega-3, 6 and 9. Okay, and make sure you're drinking a lot of water, have a lot of fruit and vegetables. Okay, and try to have foods that are rich in calcium and vitamin D and iron. Okay, that would be really good. You might find that you're going to start experiencing a lot of fatigue and be quite lethargic. Okay, and that is very common. Yeah, and as you escalate through the menopause, you might find that some symptoms go, some come, vice versa, or you might just have so many all at once. Okay, yeah, so don't be alarmed by any of that. It is perfectly normal. All right, but we want to help maintain it for you. Yes, yeah, that's correct. Some people are fine with it, and you know, those symptoms, they, you know, just push through it and get on with it. And some are adamant not to use anything, and that's their choice. Yeah, okay. So you definitely would like to try that. I don't blame you. But if you would like to use any of those bioidentical products on the market, then you can do that. It's not a problem at all. Yeah. Don't feel like you're pressured into just one, or yeah, definitely, but definitely do your research. Okay, and that would be really good for you. You're very welcome. That's what I'm here for, is to help. All right. I know it can be a very difficult time with your bodies changing and things like that, with either weight gain, or we look like we start to age quicker with our skin, and maybe grey hairs if you haven't already, and just that kind. Not so there. I know it's not a very nice time that we have to go through, but we will get through it and we'll push through it. And if you need some help with HRT, it's nothing to be ashamed of. I think it's that, isn't it? Sometimes, I give birth with, without any pain relief and things like that, or and then it's like, I'm going through the menopause and I don't need any HRT. It's not, it's not a competition on who can do what. Yeah, definitely. So don't be worried about that. Yeah. I'll definitely do that. Yeah. Okay, so where are we? There's all sorts of different types of the HRT, different strengths and things, but I'm going to start you on low dose. Okay, and give it a trial. Please give it 6 weeks, but I can guarantee you after a few days things will start to level out. I'm going to put you on Premarin, I think that's a good one. I highly recommend that dose, and I'll start you on the low dose. You may not need to go up, but you may do. All right. Yes, the cancer risks are there with all HRT, okay, and with just being in the menopause anyway. This one, you've got to weigh up the pros and cons. Yeah, you don't need to stay on it for years and years. 5 years if you wanted, 2 years, 1 year. And that's why it's very important to check your breasts with these, because there is a high risk of breast cancer, okay, and even strokes and things, and heart attacks, okay. So we need to monitor that blood pressure, and you need to try and keep that blood pressure down by exercising, getting fresh air, eating healthily, drinking and healthily. Yeah, and watch with any alcohol consumption and smoking and things like that. You need to try and keep your heart level down, okay? Yeah, definitely. But like I say, it will kick in quite quickly. We like to say, give it a good 6 weeks to try it all out. Okay, we can up it, we can keep it the same. Yeah, I'll have to see you every 6 months anyway, as a definite, because I need to check your blood pressure and, make sure everything's going okay and that you're happy with everything, and making sure that your life is as comfortable as possible. Okay, and then we have to do yearly bloods and things with it as well, if that's okay. Yeah, but if you do change your mind, it's not a problem. You can just stop taking it. Okay, but I would like you to let me know. Yeah? Okay. Yeah, I know that is a risk, and a lot of my patients say they want to take the risk. Yeah, because it is very deliberating, and it can be quite difficult mentally, emotionally, and a lot of them can get upset. It's quite be a shock to the body sometimes. Yeah, it depends on the situation as well. I mean, I've had ladies in that have had a hysterectomy and it's just hit them like a ton of bricks. Yeah, and like a surgical menopause is like full in right in. Yeah, and that's not very pleasant. Yeah. And I definitely think so, because you've been expecting it, and because you thought that's what was going to come back. We sort of know already, aren't we? So yeah. Okay. Let me just put that down. I'm going to give you that. So, 3. I've given synthetic ones, and I find that they aren't as effective. But if you did really want to try one of those, I could do that. Okay, I'll go ahead with this one. That's fine. Okay, we'll need to check your blood pressure first, just to make sure it's not on the high side. Okay. Okay, just pop on the vitamins for now. These need to be taken daily, please. You don't have to take any others or anything else, this is fine. Omega-3, 6, 9. You'll find this also helps with any vagina dryness, helps with your skin and your hair and things like that. Okay. I like to give you the omega-3, 6 and 9 separately as well. It has more of an effect, okay? So don't want you having that with the multivitamins. Yeah, so you'll have a vitamin and mineral tablet, and then you have your one tablet, which is your omega-3, 6 and 9. Yeah? Okay, the instructions will be on there how to take them. Yeah, okay. I'm not going to write the HRT down, so I've done your blood pressure. Can I get you just pop on the scales for me? Perfect, thank you. Let me just check. Okay, that's great. You haven't gained, all right. Just check your blood pressure, and then if I'm happy, I can prescribe you some HRT. Right. Okay, pop your arm there for me. Wonderful. Just relax it there. Thank you. Right. Okay. Just relax for me. Tongue tight. That's really good. Pleased with that. Okay, I can prescribe those for you. Okay, here's my pen. Okay. Just one a day, preferably in the morning, okay? And take it with water. Okay, so there's your prescription. Okay, please get that today and start it. Yes, please. Okay. Right. Do you have any other questions for me? Okay. It's fine. Don't worry. That's not a problem. What will happen is we will instruct the blood tests to be done regularly. Okay, but I'm going to get you in for a blood test, if that's okay, let's do, if you can start them tablets tomorrow morning, if you can, then I'm going to get you in for bloods in 8 weeks, and then I'm going to get you in an appointment after your bloods and we can have a chat. Yes, and I can tell you about your bloods, then I can tell you about different things. We can have a chat about HRT and how you're getting on, check your blood pressure and things, okay? Yeah, and then we'll take it from there. And then you'll automatically get called yearly to have your bloods. Okay, and then obviously you will get called every 6 months to come and see me. Okay, yeah, let me just pop that in. Do that now. Thank you. I'll get you in the phlebotomist, Christina. can do 9:30 on the 20th. 2 months then. Okay. Is that any use to you? Okay, book that one in then. And then I will see you 2 weeks later. I mean, a few days later, sorry. If I leave it a week, actually, I'll do it a week just to be on the safe side, make sure everything's back. Okay. I can do Wednesday morning at 10 a.m. That's a week later. Okay. Perfect. That's all booked in for you. All right, my pleasure. Okay, so got your appointments, got your prescription. I've answered all your questions. You don't have any more questions? Great. Yes, and we've got a plan. Brilliant. I'm glad I've reassured you a little bit, and yeah, and you know, places to go and look and things to do, and yeah, what to do at home and stuff like that. Okay. But keep an eye on your moods, keep an eye on your breasts regularly, and keep an eye on things. What I'm going to get you to do, actually, you can do me a diary, okay? So when you start your HRT, monitor your moods, monitor your symptoms. Yeah. Okay, brilliant. Then bring it with you. All right. Okay. You take it easy, all right? Like I said, in the meantime, if you need me, you know where I am. Okay, and don't forget your doctor's around as well if you do need to see a doctor. Okay. You're very welcome. You take care now. Bye-bye.